Hi and welcome. You're listening to the Fix My Brain podcast with your host, Dr. Todd Turnbull. In this podcast series, we will be reviewing the fixmybrain.org website. Thank you for joining us today. Welcome to today's broadcast. We are going to be reviewing the fixmybrain.org website, and we are on the page that says Test My Brain. If you open this website, this is the home page, and what comes up is the Test My Brain page where it says when the head suffers an impact or gets jarred, the brain is also jarred and can be concussed. The most important question to ask is how bad is it? So people ask me when they get an impact to their head, did I get a concussion? The answer is always yes. The question is, how severe is it? Some of them are very mild with minimal issues. Others, there's a significant issue and a lot of symptoms that come with that. And so today, we're going to be reviewing some of those symptoms. In part one, we're going to rate how you feel. This is going to include physical symptoms, cognitive symptoms, and emotional symptoms. All of this is based off the Acute Concussion Evaluation, which is an assessment tool that is used to evaluate known or suspected concussions or a mild traumatic brain injury. And I want you to understand that when we're talking about concussions, all concussions are a mild traumatic brain injury. And brain injuries can be classified as mild, moderate, or severe. But all brain injuries have a concussion with them. So that's a very interchangeable term, just so you know. What I have on the website here is you can go down to download the Acute Concussion Evaluation form that was created by the CDC. So if you click this link, it will open up the web page at the CDC and you'll see this downloadable PDF form. And this form has instructions with it on the second page. And on the first page, you'll see it's got the patient data, it's got injury characteristics, when did it happen, who's reporting it, the description of the injury, and then there's a series of questions in here. Where's the location of the impact? What time of day did it happen? What was the cause? Was there a fall? Was there an assault? Was it specific sports related? Was it a motor vehicle collision? Is there any amnesia with it? Is there a loss of consciousness? And just so you know, you can have a concussion without having a loss of consciousness. Are there any early signs the patient, are they dazed or confused, etc.? Are there any seizures associated with that? And I have many stories I could share with you along with that, but today we're just going to look at the symptom checklist. And if you'll notice in this box B on this form, this is the symptom checklist, and it's got physical, cognitive, emotional, and then it also goes into sleep evaluation. And I separate the sleep evaluation part out because it's a much more detailed stuff I like to look at. And this form then goes on to cover more things about red flags and other risk factors. And again, this is the physician form, so it has diagnosis and follow-up action plans. But if we're looking at our website here with the fixmybrain.org website, we've got Test My Brain, how bad is the injury, and how do you feel? So let's dive in and look at the physical symptoms. And on the physical symptoms, we're going to rate those on a scale of 0 to 10. A 0 meaning there's no findings, and a 10 meaning it's very severe. So if you'll take the little red line here that says rate your physical symptoms, you can click on that, and then it's going to open up these slider bars, and you can use this as a daily monitor, weekly, monthly, etc. And then as you go through and fill this out, how bad is your headache? Well, you can come out here and go, oh, my headache's a 5, or maybe it's out here to a 7, or even out to a 9 or a 10. And then is there any nausea? Sure, let's say the nausea 4. Is there vomiting? If there is vomiting, and by the way, if you're vomiting 2 times in a row from you just had a hit to the head and you vomited twice, that's a good sign to start taking that person for more evaluation, you want to get them to an ER. And if this vomiting continues beyond 2 times, you definitely have a high likelihood for bleeding in the brain. But you can have nausea, and that nausea could be out here at a 10. Like they're so nauseous, they're about to vomit, but they're not vomiting. And so we want to document that. Where is your vomiting level? And then are there dizziness or balance problems? Now, this is just an overall scale of our dizziness, where they're at today or within the past 24 hours. How severe is the dizziness? I have much more detailed dizziness evaluation further down on this page, but for now, we're just going to rate this on a scale of 1 to 10. Are there any visual disturbances? Is there difficulty looking to the left or looking to the right? Is there blurriness? Is the eye got tearing going on? Is there any spots, or does it things seem like they're sparkling? Or if you have rain, is the rain reflecting more light, making it more bright? And then what's the fatigue rating? Is it mild? Is it moderate? Is it severe? Where's the fatigue? Talking about also sensitivity to light. There might be no sensitivity to light, there might be mild sensitivity, there might be severe sensitivity to light. And it all just depends on where the person is at. And as you see, I'm going through these and I'm just highlighting overall where the person could be today. The sensitivity to noise could be really high. And then is there any numbness or tingling? And typically we're looking at the extremities, the fingers, the hands, down into the feet. If they've got numbness or tingling that is associated with a recent head injury, then we want to document is that mild, moderate, or severe. If that numbness and tingling was there present before the injury, then that may not be as much of a factor, although you could always include it on here. And then we also want to know that if you've got previous numbness or tingling, is it worse since you hit your head? So you can go through and do these evaluations real quick. Again, these are right off the ACE concussion evaluation from the CDC. And then you can go into the email box here and you can type in if there is a doctor you want to send this report to. You can put in their email address in here and send that to them. You want to send a copy to yourself, you just hit the submit button and it'll send those details off to whoever you like. You can send a copy to yourself and then forward it on to any healthcare providers you like. And so that's the physical symptoms. As you see, we sent that email and then it gives you a thank you for contacting us. So that would be rating the physical symptoms. Moving on, we're going to go look into evaluating cognitive symptoms. How's your brain working? On a 0 to 10 scale again, a 0, there's nothing present. A 10, it's the most severe it can be. So looking at our cognitive symptoms, this is going to include things like brain fog, feeling slowed down, difficulty concentrating, difficulty remembering. And so brain fog is like that cloud over your head. Things just feel like they're maybe a little darker. You can't quite think clearly. You're just a little bit off. And so again, is that a mild? Is that moderate? Is that severe? How bad is the brain fog? Are you feeling slowed down? And that includes both physically and mentally. Like, I just feel a little sluggish. I'm not quite myself. I don't have the same pep I used to have. My brain is just like takes a little longer to focus or get words. And then again, how mild, moderate, or severe is that today or in the past 24 hours? On the concentration, you're trying to read a book and you find out like, oh, wow, I got to slow down. The words just don't come as easy. It takes me a second to understand the words a little more than usual, or it's really challenging to read. The small print is really challenging, or the big words that you're using in your reading, if you're in textbook or in college reading, in words that you're not as familiar with. And so you got to concentrate a little more to what does that word mean and how does that fit in the sentence and in the paragraph structure? If you're doing math numbers, can I focus and keep adding those numbers together? And so your difficulty concentrating, if you're watching a TV show or a movie and you just kind of missing following along with it. That's your difficulty concentrating. And then with the difficulty remembering, this is the amnesia, and this can be associated with, do you remember details of the accident? Do you remember what was going on before the accident? Do you remember what happened after the accident? Do you have challenges with remembering somebody's name? Like, oh, I see that person. I know that person. I see them every day. It could be a coworker, but wait, their name is it Mike? Is it John? Is it Joe? Oh no, that's Jim. That's right. And so difficulty remembering. And it could be a very severe thing. And again, there might be some pre-existing issues, cognitive issues already going on. We want to associate what's going on with the patient as a result of the most recent head injury. And again, you could go down here in the email box, email this to yourself or to any healthcare provider or family members, hit the submit button, and that'll send that off to them. If you don't want to send it, you don't have to email it. You can just leave those numbers there and they'll be there when you come back. As long as you don't close the program, they'll still be sitting there. And so you can kind of use this as a daily monitor to see where you are. Or even, in the morning I got up and my brain fog is really bad. And now 5 hours later, I've gotten some food. I've been out in the sun. I've got a little activity. And now I don't have a severe brain fog. And so you can track where you're at. Moving on into emotional symptoms, and this is one of the challenges a lot of people will have, but they don't quite recognize it's associated with their trauma. You might be getting irritated or short-tempered with your spouse or with family members or coworkers. Again, a 0 means it's not present, and a 10 is very severe. So some of those emotional symptoms associated with the brain injury are going to be things like irritability and anger. Do you find that you're more irritable? Like, oh, that really bugs me so much more than it normally did. Or, I'm angry. Somebody says something and I just fly off the handle. And again, that's you get to evaluate that. If you're not sure, you can always ask your partner or coworker or family member, do I seem to be more irritable or a little more anger, more explosive, more reactive? You can always get some feedback. I will tell you the number one reaction, emotional reaction to a brain injury, to a concussion, is anger. And it's very closely followed by depression and sadness. I actually had a 5-year-old patient who his mother said, "What's wrong with my child? He's flip-flopping back and forth from being angry one second to crying and being depressed the very next second. And then a minute later, he's angry again, and then he's depressed again." And I got to tell that mother that as long as his brain is irritated, he's going to keep having that flip-flopping going on. And as his brain heals, we should see that that should diminish. Thankfully, that child did have a full recovery, and he's doing actually very well these days. Looking at yourself, are you more emotional? Are you more sensitive? Do you see yourself being more guarded? People say something like, and you react emotionally, like you might not actually have an outward reaction, but inside, you're like, oh, that person wasn't very nice to me. And they probably didn't say anything more than they normally would say to you that normally wouldn't trigger you, but today you might be a little more sensitive. It might be really sensitive. And so again, you can rate that on a daily basis. And then we also want to look at our nervousness, our anxiety. How anxious am I? And because with my brain being injured, my brain is going to be working a little more active. It's going to be very sensitive. And so I'm going to have more nervousness. I'm going to be less settled, less stable. Things are going to make me more anxious. So I can sit here and evaluate where I'm at with my anxiety. And then again, I can go down, again, email that, submit it to friends, family, healthcare providers, etc. And you can use this as a daily tracking evaluation program for yourself. Again, if you want to get the very detailed ACE evaluation form, you can go here, print that out, fill that out, bring that to you with your healthcare providers, make a copy of it for yourself and your records on day one, and then track yourself and see where you're at in 2 weeks and in a month. and note your progress. So, on our next podcast, we're going to jump into sleep issues. But for now, I want to say thank you for joining us. And I wish you health and hope for your brain injury. Thank you for joining us. Have an awesome day.